everyone, this is Professor Williamson. This is your audio to accompany the assigned non-graded exercises in chapters 18 and 19. Chapter 18 is focused on the male reproductive system and chapter 19 is focused on the female reproductive system. When you are indexing in the ICD-10 PCS coding manual, as before, it's best to use the root operation as your main term. Again, the root operation would be words such as excision, destruction, resection, drainage, etc. Then the subterm or the next term you would use in the alpha index after the main term or the root operation would be the anatomy or the body part is being surgically addressed. And the procedure or the part of the procedure that you are coding, the anatomy that relates to that. So if we first look at chapter 18, we have those code building exercises at the end of chapter 18 before the check your understanding. The first one of that particular set is a radical retropubic prostatectomy and a bilateral lymph node dissection. Some information about this particular procedure. This is a common surgical approach used by urologists for men who they believe have metastatic prostate cancer. So the cancer has spread from the male's prostate gland to some of the lymph nodes. They're going down in the lower abdominal area here and they're cutting the incision here. In your textbook, they ask you some questions. What procedures are performed in this operative episode? The surgeon or the urologist is doing a resection of the prostate and the seminal vessels and excision of the vas deferens and the pelvic lymph nodes. Second question is the prostatectomy is described as radical. Does this indicate that the seminal vesicles and vas deferens are included in the prostatectomy code? The answer to that is no. The seminal vesicles and vas deferens have distinct body part values and therefore are coded separately. This is supported by coding guideline B3.2a, which states that if during the same operative session the same root operation is repeated at different body sites that are defined by distinct values within this ICD-10 PCS system, multiple procedures should be coded. So when we have the same root operation repeated, however, it's on a different body part that is therefore defined as distinct in the coding system, we should assign a separate code. This is a picture of what they call a radical prostatectomy, so you have an understanding of what's going on in this procedure. Question 1.3, how many codes are needed for the pelvic lymph node dissection? Just for that component of the procedure. 2 codes are done because it was done specifically for this gentleman bilaterally. 1.4, what is the qualifier for these codes? Talking about these pelvic lymph node dissections. The qualifier in this case is X because it's diagnostic in nature. It's noted in the clinical information. It says that they're sent for frozen section. And again, it says bilateral pelvic lymph node dissections were performed for staging because the status was unknown for disease spread. So they are looking to see if this patient's prostate cancer has spread. What code should be assigned? For this particular procedure, you're going to have 5 codes. You're going to have a code for the resection of the prostate gland, open approach, because again, they're cutting through the lower area of the abdominal area. It's called retropubic. So the open surgical approach, the code for the resection of the prostate is 0VT00ZZ. Then you're going to have a code for the resection of the seminal vesicle, which is done bilaterally, and we have the ability to reflect that bilateral component with just one character value, so we end up assigning one code. The code for that is 0VT30ZZ. The next code is for the excision of the vas deferens. Again, it's bilateral, but we have the ability to capture the bilateral component with just one character value. The code for that is 0VBQ0ZZ. And then we have two codes for the lymph node dissection because it was bilaterally done. So we're going to have a code for excision, lymphatics, pelvis open. And we're going to assign basically the same code again for the other side of the person's body. 07BC0ZX, and then again 07BC07ZX. So again, we have 5 codes for this particular procedure. Moving on to exercise 2. This patient has a testicular torsion. The procedure performed is a right inguinal and scrotal exploration with a right orchiectomy. What is the intention or the objective of this procedure? To remove the patient's necrotic testicle that could not be saved. Question 2.2. Is the exploration coded separately? No. The exploration is integral because a distinctive procedure was ultimately performed at the same body part. So we're not coding the scrotal exploration separately. It's part of the process. 2.3, what codes would be assigned? There's only one code assigned for this procedure, 0VT90ZZ, which is resection, testicle right, open approach. Exercise 3 is defined or noted in your textbook as extensive lysis of foreskin adhesions and medial and urethral dilation. Question 3.1, how many procedures that require coding are represented in this report? What are they? There are 2 procedures. One is to treat the panomas and dilate the urethra. 3.2, what body part is being released to treat the phimosis? The penis is being released. Release is freeing a body part from an abnormal physical constraint by cutting or by the use of force. The penis in this case was constricted by the foreskin, which was cut, but the body part that was being released was the penis itself. 3.3, why is the Foley catheter inserted at the end of this procedure? What device value would you assign for the Foley catheter? In this case, the Foley is not a drainage device. It is being placed in the patient to maintain the dilation of the urethra while it heals. And therefore, this is reflected in device value of D, which is intraluminal because it's being placed inside of a lumen. And in the clinical information, it states at this time, the cystoscope was removed and the 22 French Foley catheter was placed to maintain the dilation. So yes, the man is going to urinate through it, but the intention of placing the catheter was to keep the patient's urethra open so that it doesn't collapse back down, basically. What codes would be assigned? You would have 2 codes for this procedure, 0VNSXZZ for the released penis external approach, and 0T7D7DZ for dilation of the urethra with an intraluminal device via a natural, in this case, opening. Then if we look at the check your understanding, you have 5, 2 of them are multiple choice, 2 are fill in the blank, and you have 1 true and false. The first one is the spermatic cord contains which of the following structures? A, seminal vesicle, B, dartus fascia, C, vas deferens, D, epididymis. The answer is C. The seminal vesicle is found where the vas deferens enters the prostate. It is not part of the spermatic cord. Selection B surrounds the testicles and the spermatic cord within the scrotum. The epididymis is found at the top of the testicle. It is not part of the spermatic cord. The vas deferens is found within the spermatic cord. So the question is asking you for which one of these composes the spermatic cord. Number 2 is a true or false question. Remember for your true and false questions that if any part of the question is false, if one word is wrong, then the entire statement is wrong. The question is, the male urethra is classified as a body part value in the male reproductive system in ICD-10 PCS. The answer is false. The urethra is part of the urinary system per this coding classification system. Number 3, laser prostatectomy is coded with the root operation of what? Destruction. Destruction is the physical eradication of all or a portion of a body part by the direct use of energy, force, or a destructive agent. In this case, the laser is an energy source. So when we see the word laser as a method, we are going to think, for the most part, not always, but for the most part, we're going to think root operation destruction. Qualifier values other than X and Z are assigned to which type of procedure in this section of ICD-10 PCS? You have 4 options: alteration, bypass, creation, and repair. The answer is B. Bypass is the only root operation in the male reproductive system of ICD-10 PCS coding that requires a qualifier value other than X or Z. Number 5 is a fill-in. A circumcision is the surgical removal of the prepuce body part. Then if we move to the procedure coding statements, you have 10 of them. The first one is a retropubic total prostatectomy. Again, you're going to determine, it says total. We're going to use that. That's what we have. We're going to make that all of the prostate was removed. All of a body part removal was coded to the root operation of resection. You're going to index resection and then the anatomy, which is the prostate. Also retropubic, as noted in that previous example above with the patient, is an open surgical approach. So if we go back up to that picture, this is where they're making that incision. So this is somewhat of a repetitive idea, but the word retropubic is an open approach as described in the chapter. Final code assigned is 0VT00ZZ. Number 2, open reduction of a left testicular torsion. This is a picture of a torsion. A testicular torsion is a twisting of the testicle in the spermatic cord. To reduce this torsion, the testicle is unwound and placed back in the correct surgical position or correct anatomical position. Therefore, the root operation reposition is used. Per the information, it was an open surgical approach. So we're going to index reposition and then testicle. We end up with the code of 0VSB0ZZ. Number 3, the patient has a penile prosthesis. It is removed because it's causing problems, and he has a second one put in called a Dora phase 2. Was inserted, again, open surgical approach. We're going to have 2 codes for this one. We're going to code the removal of the old prosthesis, and we're also going to code the placement of the new prosthesis, which is being used to supplement his body part. The code for the removal of the old prosthesis is 0VPS0JZ, and the new one is 0VUS0JZ. Again, that's supplement because it's augmenting the biological function of that body part. Again, it's open surgical approach. It says it right here in the clinical documentation. Number 4 is puncture aspiration of the left hydrocele of the vas deferens. Hydro is a word, portion of a word that means water or fluid. So this, on the left here, you have a picture of a healthy testicle. On the right, you have a picture of a hydrocele. There's a collection of fluid in a place where there shouldn't be. The clinical statement says procedure aspiration. They're going to aspirate out this fluid. That equates to the root operation of drainage. It also states it was a puncture. You go back to chapter 1, puncture equates to the surgical approach of percutaneous. Root operation is drainage. Surgical approach is percutaneous. We know the anatomical location. The code is 0V9P3ZZ. Number 5, the patient's having a right testicular biopsy. Open approach. We know the location. We know the surgical approach. Only a portion of a tissue is being removed when the surgeon is doing a biopsy. Therefore, the root operation is excision. The code is 0VB90ZX. The final character is X because this is noted to be a biopsy, which means they are looking for some diagnostic information. Number 6 is a percutaneous drainage of an abscess of the right epididymis. Again, we have a picture of normal and not normal. So I remember ITIS is inflammation. So this portion of the patient's anatomy is inflamed, most likely with some type of infectious fluid. They're going in and draining it percutaneously. The root operation is drainage. The surgical approach is percutaneous. The location is given to you. The code is 0V9J3ZZ. And there's no documentation that that fluid is being sent for analysis, so we're not going to assume that. The last qualifier value is Z. Number 7, removal of foreign body from scrotum. Open approach means open surgical approach. Foreign body equates to the root operation of extirpation. Code is 0VC50ZZ. Again, you're going to index extirpation, then scrotum, and then once you get to the table, you're going to choose open. Number 8 is right orchopexy via scrotal incision for undescended testes. It says incision, that equates to an open surgical approach. You know what piece of anatomy. You have the the laterality. We talked about in the lecture about the undescending testicles. That equates to putting them back in the right anatomical position, is the root operation of reposition. Code is 0VS90ZZ. You're going to index reposition, testicle, right. Number 9, surgical removal of the left epididymis for chronic inflammation, open approach. We're going to code this to resection because that piece of anatomy is one body part in our ICD-10 PCS coding system. So we're going to index resection, and then the anatomical location, it states it was open surgical approach. We end up with the code of 0VTK0ZZ. Number 10 is documented as moving ectopic testicles to scrotum open approach. Remember that the word ectopic means out of place. Women can have ectopic pregnancies. Men can have ectopic testicles. They're a little bit different than undescended. Undescended testicles are too high but could come down in the right location. Ectopic testicles are totally out of place. They're never going to be in the right place even if they came down and descended. So they have to be surgically addressed. Tells you the surgical approach is open. And again, the physician, the surgeon is moving something, in this case the testicles, into the correct anatomical location. The root operation is resect, reposition, and the final code is 0VSC0ZZ. Again, it's open surgical approach, and typically these would be done open because they're typically high up in the patient's abdominal area. In this picture, the darker ones are ectopic. They have to be put in the right position, which is reposition. Then if we look at the operative reports, now in this particular chapter and chapter 19, you should be coding all of the operative reports as non-graded assignments. None of these are part of the graded assignment in this class. You have separate clinical documentation given to you for the graded assignment in this class. So the first one is a patient who is noted to come in for a desired sterilization. When we read the clinical report, the man is having a vasectomy. What is the intention? If you go back to the chapter information, a vasectomy, the intention is occlusion. Your root operation is going to be occlusion, vas deferens, because that's what's being worked on. That's the piece of anatomy that's being cut in this case. Your final code is 0VLQ0ZZ. And the physician makes an incision. It states in the clinical report, an incision was made overlying the vas. The vas was identified and brought through the incision. That means open surgical approach. Number 2, partial prostatectomy. Again, we know the anatomy. We also know the word partial. So if it's not the entire prostate going in, we would not code this to the root operation of resection. This is going to be the root operation of excision. Also, it's noted that this was done via the use of a cystoscope, which is an endoscopic device, so it's not an open surgical approach. We're going to index the word excision and prostate. We're going to make sure we choose the body part or the surgical approach value of 8, which is a cystoscopy or cystoscope or endoscope. In this case, via a natural opening. It states in the clinical information, the patient was identified and procedure confirmed. The resecting cystoscope was introduced. The prostate was resected to create a wide open urine passage. Final code is 0VB08ZZ. Number 3, the patient's having a bilateral orchiectomy. It states this is a 71-year-old male, developed leg swelling. CT scan showed retroperitoneal lymphadenopathy. Patient has suggested prostate cancer. He was advised to have a bilateral orchiectomy. The patient agreed to surgery. It says after satisfactory general anesthesia, the patient was prepped and draped in a supine position. Incision was made in the median of the scrotum. This is an open surgical approach. We have that word incision. We know that this patient's testicles were removed. The left testicle first, and then the right, per the clinical information. We do have the ability when we move to the 0VT table to reflect bilateral, so we end up with just one code for the removal of both testicles, 0VTC0ZZ. Again, it's open surgical approach because that word incision is used. Number 4, patient has BPH or benign prostatic hypertrophy. It's documented that he's having a cystoscopy. Then the second procedure is evolved laser transurethral resection of the prostate. And the third procedure documented in the report is electrosurgical transurethral resection of the prostate. So we know that this is patients having work done on their prostate gland. It's also done via cystoscopy. It says a 22 French cystoscope sheet was lubricated and inserted into the urethral meatus. So this is done via a cystoscopy. It was not done via open surgical approach. Then it goes on, the surgeon documents he used a laser. So that changes our root operation in terms of being either excision or resection. The use of that word, the use of the word or documentation of the use of the laser equates to the root operation of destruction. This is the evolved laser fiber was advanced, and then he removed some portion of the prostate gland. But it says at the conclusion of the case, there seemed to be some degree of excess median lobular tissue remaining. Therefore, we elected to perform conventional transurethral resection of this portion of the prostate. So after the physician did the laser, he noted that there was still more prostate tissue left, and he went in and he retrieved that through what he calls a traditional transurethral resection. Now, he had already taken out some of the prostate gland, so he can't use resection for the second component. The second component was not done by the laser. He says it was traditional, which means with a scalpel. Or some other cutting device through the cystoscope or the endoscope. So we end up with the destruction for one root operation, which is the use of the laser, and then excision for the other. Can't use resection because he already took some of it out. So we end up with two codes, 0V508ZZ and 0VB08ZZ. There's no documentation that this was a diagnostic procedure. Yes, the specimens were sent to pathology. But at the beginning of the procedure, the physician already knew that the patient has benign prostatic hypertrophy. It says history of lower urinary tract symptoms linked to benign prostatic hypertrophy. So they were not looking to diagnose anything, but they're going to, as per clinical practice, send specimens out to pathology. But there's no documentation that's diagnostic in nature. And the cystoscopy is not separately coded. We're reflecting the cystoscopy as a surgical approach with the 8 character value in both of our codes. Number 5 is a patient who's coming in for a circumcision. It is an adult patient. The complete removal of that portion of the male anatomy is coded to the root operation of resection. The physician doesn't have to make an incision into tissue to get to it. It's performed directly on the skin. So the surgical approach is external. It states in the operative report a 3.3-0 chromatic suture was placed on the ventral side, connecting the cut ends of the tissue. The curved hemostats were used circumventrally around the penis on the right side to the desired length of the circumcision. After the tissue was crushed, it was divided. So there's no documentation of any incision cutting into anything. So the final code is 0VTTXZZ. Number 6. Patients coming in for a circumcision revision and a urethral medioplasty. That word plasty is a clue. You'd be thinking plasty by definition, or medical terminology, means repair. So this gentleman, it's a 13-month-old child, 13-month-old male. It looks like he had a circumcision, but there's some issues with it. So he's coming in for a circumcision revision. The physician does make an incision. It says the obstructing lower lip of the urethral meatus was crushed and incised. Redundant prepuce was excised. So apparently he had a circumcision, but it wasn't correctly done. So excess tissue was removed, excess foreskin. Root operation is resection. They also had to do a repair of part of this child's urethra. Both our surgical approach was external. So the surgical value of external is going to be used. Your final codes are 0VTTXZZ and 0TQDXZZ. Number 7 is an 8-month-old child, male, who has hypospadiasis and cordia repair. Just so you understand what that means, what it looks like, this is a picture here. Information is here. It is a birth defect where the top opening of the urethra is not in the right location. Cordia is a bending of the penis. This condition can range from minor to severe. The level of severity depends on where this opening is. So again, the physician is working on putting something back in the correct anatomical location. That works on the hypo component. To correct the bowing of the penis, the root operation release is what is used. So we have 2 separate root operations, which means we're going to have 2 codes. We have 0TSD0ZZ and 0VNS0ZZ. Also remember that this hypo condition is working on the urethra, okay, not necessarily on the penis itself, where the second, in this case, the second condition is working on the penis in terms of root body part value. Number 8, which is the last one for chapter 18, is hydrocele-ectomy. This patient's hydrocele was on the left spermatic cord. Again, we had that picture earlier, this collection of fluid. They're taking it out. It says the hydrocele was removed through the incision and peeled of its fibrous attachments. We have the word incision. That means an open surgical approach. This piece of the patient's anatomy was removed. That was located on their left spermatic cord. However, the entire cord was not removed. So the root operation is excision. Final code is 0VBG0ZZ. I'm going to pause here for a minute. If you want to stop the presentation, you can do so and come back at another time before we move into chapter 19, which is the female anatomy. So if we're looking at the code building exercises at the end of chapter 19, again, female anatomy, the first one is examination under anesthesia, excision of prolapsing graft pieces, and repair of an anterior vaginal wall dehiscence. The first question asked is 1.1, which root operation would be assigned for the trimming of the graft material? That would be revision because the graft is a device and that device is malfunctioning. So those graft pieces have now moved down into a place that the physician or the patient doesn't want them. They've prolapsed. They've moved out of their correct position. It states the graft was trimmed and the ends that were prolapsed were removed. 1.2 question, which body part value is assigned for the repair of the dehiscence? G is the body part value, and that relates to the vagina. Dehiscence is a wound infection. So this woman had surgery 2 weeks prior to this event that we're coding. And she has, in addition to what they did in that previous surgery, is now prolapsed, a graft. She also has a wound infection. Or wound opening, surgical wound opening. It's opening too far. And that can often happen when we have anatomical locations that are supposed to be moist and have mucosa in them, which is what is happening in her body. And that's normal, but it can happen, the wound dehiscence component can happen in areas of your body that hold more moisture or have more mucosa in them. 1.3 question, what codes are assigned? You have two codes, 0UWH, 0JZ is the code for the revision of this graft material, which was a synthetic substitute. And then for the wound repair, the code is 0UQ, G0ZZ. So you have two separate root operations, revision for the work on the graft, which he notes in the clinical information as excision, but it's revision. And then the repair of the wound of the vaginal wall dehiscence is repair. Exercise number 2. Patient has a vaginal prolapse. Is coming in for a bilateral sacrospinous suspension posterior repair. You have 4 questions asked. 2.1, how many procedures that require coding are represented in this report? What are they? There's 2 procedures. You have the vaginal suspension, which is using a device. That's one procedure. And then the retroseal repair using a device is another procedure. Number 2.2, what root operations are assigned for these procedures? Supplement is assigned for both procedures because a device is used to accomplish both. In the vaginal suspension, the device augments the function, and in the retroseal repair, the defect is repaired with a device. If a device had not been used, the root operation would have been repositioned. But when a device is used to accomplish the intention or the procedure, supplement is used. Question 2.3, research Surgi SIS. What device value would be assigned for the use of this material? The answer is K. I'm going to move that down. K, which is a non-autologous because it's made of porcine material. So K is not human. Porcine means coming from a pig. If you go to this website or you found another website, this is from the manufacturer of this graft material. It says it's a bio design, which are absorbable multi-layer sheets of extracellular matrix collagen derived from porcine small intestinal submucosa. Unfortunately, at this moment in time, there's no option at that table for a zooplastic designation. But we do have the designation at the table that says this is not human material. It's not human biological material, which is non-autologous, so we choose that option. What codes are assigned? 2 codes are assigned, 0UU, G0KZ, which is supplement of the vagina with a non-human tissue substitute, open approach, and 0JU, C0KZ, supplement subcutaneous tissue and fascia, pelvic region, non-human tissue substitute, open approach. Number 3 in that section, patient has an exploratory laparotomy with a supracervical abdominal hysterectomy and a bilateral salpingo-oophorectomy. You have 2 questions asked. Surgeon identified one of the specimens as the uterus, in quotation marks. In this procedure, did the surgeon mean only the uterus or the uterus and the cervix? Which documentation supports your answer? Only the uterus was removed. The documentation states that the patient identified a desire to retain her cervix. The cervix was amputated from. So again, this particular patient only had her uterus removed. What codes are assigned? Well, she had her uterus removed and her fallopian tubes and her ovaries, but she did not have her cervix removed. What codes are assigned? 0UT90ZZ is for the uterus removal. Total is resection. Both of her ovaries were removed. In total, we have the ability to reflect that one character value for body part that identifies bilaterally. So we have one code for both ovaries, 0UT20ZZ, and her fallopian tubes were removed. We also have again one body part character value that reflects both fallopian tubes. So we have one code for both, 0UT70ZZ. Then we have our check your understanding. The first 5, you have 2 multiple choice and 3 fill in the blank. Oh, sorry, 2 fill in the blank and 1 true or false. The first question is a true or false. The vulva is a combination of internal female reproductive body parts. That statement is false. The vulva is a combination of external, not internal, female genitalia. Number 2, a hysteroscopy performed without any additional procedures, just looking in the patient's uterus, is coded to the root operation of what with an approach value of what? It's coded to the root operation of inspection with the approach value of via a natural or artificial opening. Endoscopic. A subtotal hysterectomy, now we're talking about taking out part of a uterus. A subtotal hysterectomy removes which of the following body parts? Vagina, cervix, uterus, and cervix. The answer is C, uterus. The term subtotal hysterectomy, also called a supracervical hysterectomy, means that only the uterus is removed and the cervix remains intact. So the answer is C. Number 4, the only body part that can be transplanted in the female reproductive system at this time is ovary. Number 5, combination body part values such as vagina and cul-de-sac can be used with which of the following root operations? You have 4 options: bypass, destruction, excision, and inspection. The answer is D, inspection. Body part values for combined structures such as vagina and cul-de-sac are available for use, including the root operations that involve devices or inspection. Body part values for combined structures are not available for use with any other root operations in this system. We move on to the procedure coding statement. You have 10 of them. The first one is a vulvar biopsy. Biopsy equates to removing some tissue, not an entire piece of any piece of anatomy. Root operation is excision. This is the vulva, which is external genitalia of a female. So there is no incision required to get to it. The root operation is excision. The approach is X for external. Final code is 0UBMXZX. It is noted as a biopsy, so the last character value is going to reflect diagnostic in nature. Number 2, bilateral tubal ligation by fallopian ring, laparoscopic. This laparoscopic identifies how this procedure was done. Again, as talked about in the male anatomy, when we talk about a vasectomy or sterilization, the intention is occlusion. Same for the female. We're occluding with this ligation. We're cutting off the flow of a fertilized ovum. So the root operation is occlusion. It's done by a device called a fallopian ring. This patient is having it done bilaterally on both fallopian tubes because you have 2 of them, or women have 2 of them, and also the approach is laparoscopic. We're closing off a lumen, root operation occlusion, 0UL74CZ. Number 3, harvesting of an ova for in vitro fertilization, percutaneous approach. You're told the surgical approach. The harvesting of an ova is the root operation of extraction because they're taking or they're pulling them out of the ovary. 0UDN3ZZ. Number 4 is a supracervical abdominal hysterectomy. All of the patient's uterus is being removed. That equates to the body part value of resection. It's documented as going through her abdominal cavity. How are they going to do that? They're going to have to make an incision. So the surgical approach is open. The cervix is not removed. 0UT90ZZ for resection of the entire uterus, which is a 1 body part value in ICD-10 PCS. Number 5 is colpoclesis for vaginal vault prolapse. What are they doing? They're securing the vaginal walls to keep the opening closed, so to speak. This is typically done when a woman has a prolapse. So things are not in the right location. Things are moving out of her body through her vagina. That they don't want to do that. Sutures are used, but sutures are not identified as a device. If you remember back in chapter 1, our final code, our root operation is occlusion. Our final code is 0ULG7ZZ. Number 7, patients having a hysteroscopy. They're just looking in her uterus. There's no documentation of any cutting, no removal of any structures. The root operation is inspection. It's done with an endoscope, which is a natural opening for the most part. We assume it's going through a natural opening. And the code is 0UJD8ZZ. Number 7 is an endometrial ablation. Ablation is using some type of force. So that relates to the root operation of destruction. We have the location is the endometrium. Our code is 0U5B7ZZ. Again, root operation is destruction. Then we're going to index endometrium, and via a natural opening. There's no documentation that an endoscope was used in this case. Number 8 is a percutaneous right ovarian biopsy. That word biopsy, right off, means diagnostic. We know that our final character value is going to be an X as long as it's available to us at the table. It also means that only part of the tissue is removed, in this case from the ovary. So the root operation is excision. Also, in this case, it tells us the surgical approach was percutaneous. We're going to index excision, then ovary, then right. We finally end up at 0UB03ZX. Number 9 is drainage of the Skene's gland abscess without a drainage device. Root operation is drainage. Then we're going to index the anatomical location, and we're going to use the word gland first, then vestibular, because if you go back into the chapter, they talk about these glands and how they're characterized as vestibular. It states surgical drainage, so that equates to the using of a scalpel. He's cutting into this gland abscess. No biopsy was taken that we know of. It doesn't say anything about this fluid or what came out of this abscess was sent off for pathology. Final code is 0U9L0ZZ. Number 10 says a bivalve speculum was placed in the vagina and the cervix was prepped with betadine solution. The uterine cavity was sounded at 7 centimeters. The endometrial cavity was curated for tissue sampling. The word sampling is important. Specimen was sent to pathology. The patient tolerated the procedure well, left the operating suite in good condition. So they went in, they opened up this woman's uterus in terms of they expanded it, they dilated it, and they took a specimen from her endometrium. They cut it out with a curette. The root operation, when physicians work on an endometrium, is often going to be extraction because they're pulling it or scraping it. He also went in via a natural opening, the vagina. The uterine sounding is not coded separately. That is, again, a procedure to see how deep her uterus was. They use an instrument, a uterine sound it's called. So we don't assign a separate code for that. This cavity was, part of her endometrium was taken away from her and sent off for tissue sampling. That is diagnostic in nature. We're going to use the root operation of extraction. And endometrium is our body part value. We have 0UDB7ZX. At the end of chapter 19, you have 8 operative reports. The first one is a retropubic urethropexy cystocele repair. So you understand this is a cystocele picture. We have something kind of moving down. We have this extra large area. It shouldn't be that big. Her bladder shouldn't be that large. It's kind of moving, prolapsing, so to speak. On the right here is normal. And then we have this retropubic suspension, which is this urethropexy. Pexy is typically tacking something back, and typically they're using sutures. So the root operation of repair is assigned for the work on this cystocele, and that relates to the location and everything. Then for the work on the suspension, they're trying to move something back into its normal position. The root operation for that is reposition. The urethra is what's being worked on. And our final codes are 0JQC0ZZ and 0TSD0ZZ. And this is all done open. You often see this in elderly women. They start having prolapse. Sometimes it's because of a trauma. Sometimes it's because they've had multiple pregnancies in their lifetime or whatever reason. He says in the operative report, the fascia was cut in the midline. The fascial incision was extended laterally by sharp and blunt dissecting. So this was an open surgical procedure. Number 2, it states that this patient has recurrent ovarian cancer. The procedure is examination under anesthesia, exploratory laparotomy with planned cytoreductive surgery. Patient was taken to the OR. Anesthesia was administered. She has a large mass in the left upper quadrant, multiple nodules of tumor in the subcutaneous tissue of the mid portion of the abdomen. The exam was consistent with having recurrent widespread ovarian cancer. The old scar was excised and the abdomen was entered through a midline vertical incision. So they made an incision. This woman has multiple tumors. She has a tumor mass of her spleen. She has a 20 by 20 centimeter mass involving the transverse colon, another one in the inferior portion of her stomach, another one in her ascending colon. She has a large mass incorporating her rectosigmoid, the undersurface of her bladder, and her vagina. And it was decided that it was unresectable. It says, based on this, it was my impression that cytoreductive surgery was impossible. It was also my opinion that we were unable to provide any sort of palliative procedure which would allow the patient to urinate. So she's having issues going to the bathroom, and they try to go in and remove something so that they can at least give her some relief in that component of being able to urinate. But she has extensive metastatic cancer, including tumors throughout her colon and her bladder. Finally, it was my impression that pursuing further surgery was likely to result in significant blood loss, which would require multiple bowel anastomosis because she has multiple tumors in her colon. They abandoned, he says, based on all of this, I elected to abandon the procedure, and they closed her up. So this is a very difficult case, obviously, to read. This woman goes in, they think they're going to try to help her a little bit. They open her up and they find multiple metastatic cancer throughout her bowel and her bladder. And now they basically are going to close her up and try to make her as comfortable as possible. She cannot, most likely can't defecate or go to the bathroom at all. So, the root operation is inspection, because once the physician opened her up, there was nothing that he did other than look around, unfortunately. He inspected her peritoneal cavity and her pelvic cavity. You have two codes because you have two separate pieces of anatomy. You have 0WJG0ZZ and 0WJJ0ZZ. And again, it was an open surgical approach. She cut through the old scar midline through her abdomen. Number 3 is a LEAP procedure. Again, this is typically a procedure that's done to take out a bigger piece of tissue of the cervix. This patient has moderate dysplasia, but they're not taking out all of the cervix. So the root operation is excision, anatomical location is cervix. There's no documentation in this particular piece of clinical information that this was sent to pathology for diagnosis. It could have been, but it wasn't documented as such. We can't assume. The physician needs to provide that information. So we don't assume, and we code it with the final character by U of Z. Our final code is 0UBC7ZZ. Number 4, patients coming in for a diagnostic laparoscopy. They end up doing an excision of a left ovarian fibroma. Patient comes in for the clinical documentation. They administer anesthesia. She had already had a hysterectomy, so she doesn't have a uterus. They go in and the left ovary was identified, the right ovary was identified as well. The right ovary appeared completely normal. The left ovary was slightly enlarged, but did have two obvious cystic structures about 2 centimeters each in diameter. We use unipolar cautery. Deep within the ovary, we could feel a solid fibrous structure that appeared round and appeared to be a fibroma. Fibroma is a benign tumor. We were able to incise the ovary around most of the structure and then remove the fibroma in one piece. We then increased the size of the port and then removed it through the abdominal wall. So they did not take out the entire ovary. They just removed the fibroma from inside the ovary itself. They also did this via a laparoscope, which is an endoscopic type of procedure. So there was no cutting through her abdominal wall. There were small incisions made, but they did use an endoscope. They only took out part of the ovary. They didn't take all of her ovary. Root operation is excision, 0UB14ZZ. Number 5, patients having a laparoscopic assisted vaginal hysterectomy and a bilateral salpingo-oophorectomy. This woman is having structures removed. She's having both her ovaries, both her fallopian tubes removed, and her uterus, and her cervix via a laparoscopic assisted method going through her vagina. She's having 2 fallopian tubes, 2 ovaries removed, uterus and cervix. That's 6 structures. However, we have the ability to capture bilateral on our ovaries and bilateral for our fallopian tubes. So we end up with 4 procedure codes. In terms of your clinical documentation, they made a 1 centimeter incision, which is very small, less than an inch. They put in the devices. They put air into her stomach. The abdomen was insufflated. They did trocars, which is, all of this is part of this laparoscopic component. Then he says our attention was then turned to the vagina. So they used the vagina as a way of getting things in and getting things out in terms of structures. The cervix was grasped and the cervix was dissected and removed. So they took the cervix out. It says the uterus tubes, talking about the fallopian tubes, and ovaries were then easily removed through the vagina. So they put these, laparoscopic assistant, meaning he's using that to guide him, the surgeon's using this laparoscope to guide him, and then basically pulling things out through the woman's vagina. You end up with 4 codes, 0UT, 9FZZ, 0UT2FZZ, 0UT7FZZ, and 0UTC7ZZ. So you see these codes are very similar. The only difference is the 4th character value, which is the body parts. Number 6, patient has a hysteroscopy with fractional dilation and curettage for evaluation. This patient is having excessive menstrual periods and also has a benign growth of her uterus. So the physician's going in to look around and see what he can do, and also do a DNC, a dilation and curettage for evaluation. That's important because that impacts our code assignment for the last character value. So if we look at the information, they did a hysteroscopy. They go in and look. The findings revealed that the cavity of the uterus appeared to be enlarged and distorted, and the uterine wall was not smooth. It appeared to be compressed by an intramural leiomyoma. So she has a tumor of a muscle, like a muscular wall. A small intrauterine polyp was identified and removed for biopsy. The endometrium appears to be thick and fluffy. The endoscope was withdrawn and a small sharp curette was used to correct the endometrium. So she had some endometriitis, most likely, or something going on with her endometrium. He says it was thick and fluffy. That's not normal, so to speak. And she also had a biopsy of a small intrauterine polyp. So we have two codes, 0UB98ZX and 0UB7ZX. Okay, we have the polyp that was being biopsy, so that's going to make that an X, and we also have this endometrium that's being biopsy, so to speak. We have excision for the polyp, and then extraction. You have to really get that in your head that when we're looking at these endometrial removals or endometrial biopsies, that we're going to be using the root operation extraction. Next one is transabdominal cervical cerclage. Typically, this is done on a patient who's pregnant and there's some risk or high risk of her having an going into labor early, so they're closing off her cervix. It also states in the top of the operative report, transabdominal, which means going across her abdomen. It states under general anesthesia, the abdomen was opened using a transverse suprapubic incision. So this is an open surgical approach. The intention is to close this opening of her cervix. That is the root operation of restriction. And again, it's an open surgical approach. 0UV-C0CX, CZ, 0UV-C0CZ. The approach is abdominal, value of 0 for open. An extraluminal device is used to restrict the cervix. Looks like you use tape. I'm looking for, it says the bandwidth of the tape was verified as being flush with the anterior cervix tissue. So we use some type of device, and our final code again is 0UV-C0CZ. And the last one is a patient who's having pain, pelvic pain, and has a right ovarian cyst. They're doing an operative laparoscopy with a right ovarian cystectomy. Operative findings noted in your clinical information is a 4 centimeter appearing hemorrhagic right ovarian cyst, evidence of endometric implant of the right ovarian capsule. So she has tissue that's moved from her endometrium, which is a lining of your uterus, a woman's uterus. She has tissue that's in a wrong place. It's on top of her ovary. Her endometrium tissue is on top of her ovary. Bilateral tubes appeared normal, uterus appeared normal, the rest of the pelvis appeared normal, upper abdominal survey appeared normal. So they did a bivalve speculum was placed in her vagina, so they're going via her normal anatomy. And once the physician gets in here, he destroys that extra tissue, which he calls an evidence of an endometric implant. He destroys that with electrocautery. Which is the root operation of destruction. In the clinical statement, about halfway through the last paragraph. It says a 5 to 8 millimeter Versa port trocar was similarly advanced using similar procedure under direct visualization. So in addition to going through her vagina, he also used a laparoscope, which he said he was going to do, operative laparoscopic. So he's going through the side of her abdominal cavity, putting in small incisions and putting in something that so he can see what he's doing instead of opening and doing a big incision down her abdominal wall. He's using these small portals to put a device in that gives him a picture, able to see what's going on inside while he's working in there. He's a surgeon. So that's what he's talking about with the trocar. Trocar is a device, an endoscopic device. The pelvic and other findings were noted above. That's what he talked about under operative findings. The endometronic implant, and he's talking about tissue. It's not a device that someone put in there. This woman's got tissue that has implanted itself in an incorrect location. The endometronic implant on the right ovarian capsule was coagulated with cautery. Parts of the cyst wall were removed by grasping it with a dissector. The thin part of the ovarian capsule was excised using the scalpel and retrieved. So he destroyed this tissue that was implanted in the wrong location. That equates to the root operation of destruction. He also removed this cyst from the woman's ovary. He says the right ovarian capsule was excised. He didn't take the entire ovary. There's nothing that says that. So we're going to code the root operation of excision for that. And of course it's ovary and it's right. We have two codes, 0U5 and 04ZZ. That's for the destruction. For the ovary, because again that tissue, it was endometrial tissue, but it was on the patient's ovary. So the body part that he's touching, he's the surgeon, to destroy tissue on it is the ovary. And then he also took a right ovarian cyst off. We have 0UB, 04ZZ. So that is the end of this presentation. If you have any questions, you can contact me via the inbox in Canvas, or you can post your question to the forum in this particular lesson. Thanks.